recording. Hopefully everything is recording and we are good to go. Lea Hamner, welcome on the Bus Driver Experience. How are you doing today?
I'm doing well. Thank you very much.
I'm very happy you were able to take this call and don't jump on the show. I can't imagine, what it's like working in a pandemic going on around the world. We haven't had one of these in, a good 100 years. And lo and behold, we jumped the epidemic to a pandemic. Because I could say we've had definitely a few epidemics every so often. People like to associate them with every 2 years of an election cycle, but I don't think it works that way. Or worse.
Yeah.
Awesome. So I'd love for you to, introduce yourself way better than I could. So give people a little bit of background, who you are, where you're working at, and what you're working on.
Sure. So again, my name is Lea and I'm a communicable disease epidemiologist. What that means is I like to study infectious diseases, how they transmit from person to person, but also how to prevent that from happening really is what our goal is at the end of the day. And so I am based in Skagit County Public Health. We're a county of 125,000 people, so it's not that large, but we're pretty much sandwiched between Vancouver, BC, and Seattle. That's only a 2-hour drive. So it's a pretty condensed corridor on I-5 where there's quite a large population center north and south of us. So even though we're not that big, we still have lots of people traveling through. We have lots of different people coming into the county. So it's an interesting place to work. And also being a small county, we're a small team. We're usually only 6 people in the whole communicable disease department at the Department of Public Health in our county. And so 6 people is not an adequate number these days. We've roped in pretty much every single person of our 60-person public health department into this response at this point. But I'm interested in also communicating what our normal looks like as well as what pandemic looks like, because I think that helps people understand what a public health department does.
Mm-hmm.
And part of that is really we're disease detectives. That's our job, is figuring out where diseases came from, who had it first, who they gave it to, and who's infected next, and trying to prevent that from happening. So that involves calling people all the time, trying to do interviews to figure out where they might have gotten it. And we do every communicable disease that's legally notifiable. And outbreaks, when you can't anticipate what's coming next, counts also. But there's like 95 different diseases we're responsible for at any given time to be able to respond to.
That's amazing.
So
How you have to keep on top of. It's amazing.
it's a great job because honestly, you're always learning, and you have to be willing to say you don't know the answer, and you have to be willing to educate yourself really fast to be able to respond appropriately. And so it's a lot of fun, but right now it's pretty stressful. So
I can't imagine. I mean, would you say you have to be constantly learning because, these things are living organisms and they're constantly adapting, evolving, and mutating themselves, that, you kind of got to stay ahead or guess where they're going, their next move is next?
yeah, it really depends. I would say a lot of the bugs we deal with are actually fairly stable. They've been the way they are for a long time. It's maybe human dynamics that change and make it easier for them to spread. Climate change impacts a lot of the diseases we see, especially anything that starts with an insect, like tick-borne diseases or mosquito-borne diseases. Those will change where those start showing up as climates change. But also just global travel made everything happen in your own backyard that you never thought you'd ever see.
People take that for granted, just how things can spread. And, we see that with animals. I'm from Florida, and you see with the amount of animals that have been dumped into Florida, especially into the Everglades as, species that would never exist there, but it's actually the perfect climate or habitat for them. And, you add something that we can't even see, which are infectious diseases. And I mean, the way those things can travel and spread, it's, we take it for granted, but also it's like the perfect setup for, an organism like this.
Yes, it is the perfect setup. And one of the things that we in infectious disease we always knew something like this was going to happen. It was not a matter of if, it was a matter of when. It's much like us West Coasters thinking about earthquakes. Like, there was that huge New York Times article about how the Pacific Northwest is going to get absolutely rocked at some point in the next 200 years. Don't know when in the next 200 years, but we're going to get rocked by a mega earthquake. That's kind of the same perspective we have in infectious disease. At some point, we were going to get rocked by a pandemic. I know a lot of people are really sinking their teeth into some conspiracy theories, bioterrorism theories, but you know, it really is an inevitability that a bug, a virus would jump from animals to humans and be highly infectious. And then people would fly around the world and take it with them.
Hmm. Before we jumped into that part, because that's a whole nother can of worms, so to say, I wanted to ask you about that human dynamic you just mentioned. And, not necessarily these, diseases, whether they're a virus or they're bacteria, have necessarily changed or mutated or moved. What are some of those human dynamics that have, impacted us to be more susceptible to some things like these happening?
Well, so what immediately jumps to mind is another epidemic that I've been trying to raise awareness about in my job is STDs. In my county, gonorrhea has gone up 700%. 700% in 10 years.
I
It's,
don't want to laugh, but I'm laughing.
yeah, I know. It's painful to think about. It's crazy. And there's a lot of reasons why you could suppose that that happens. But one of the major theories people love to blame is hookup culture and dating apps and being able to find partners where you couldn't find them before. So that is a human dynamic that has changed a lot in the last 20 years. And so that is an example that immediately pops to mind. Others is just the amount of people that just travel the world and then they're really getting into jungle territory or they're getting into all sorts of animal interactions. Those kinds of experiences are very easy for a viral transmission between an animal and a human.
Hmm. And I think that leads us, jumping into the big topic, the COVID-19 and this, mutation of the coronavirus. Am I right in saying that?
Yeah,
We
well, it's not, it's its own coronavirus, it's its own
Okay.
species. So, yeah, it was in a, I think it started in a bat and then it jumped to a pangolin, is what their theory is, and then it jumped to a human.
Yeah, I've
So,
seen some of these wet markets in South America. I was actually in China in December, in India. Not too long of a time, but like you said, how we travel and how we get to where we got. And I think a lot of people don't understand too that, since agriculture, this is one of the trade-offs of agriculture, since we've been this close with animals, especially the mammalian animals that are very close to us. Some have very close code, DNA and genetic codes to us, that the jumping of species has been the biggest blunder of agriculture for our societies, we could say, because smallpox came from, was it cows or pigs or and a lot of these very, very big diseases that wiped out other civilizations and peoples, and people don't want to look at that, or
yeah, I mean, obviously the forces for agriculture and expanding agriculture is ever forging ahead. I mean, we just have an ever growing population, we have an ever growing need to feed them. So that's a hard thing to balance with this hypothetical in some people's minds. They don't see it as an inevitability. They haven't seen a pandemic like this in their lifetime. They don't know what that feels like and looks like as a consequence. And so it's very hard to convince people to invest in something they don't know to be catastrophic. They haven't felt that. We tried to really evoke that feeling of preparedness and trying to rally the troops into investing in public health at the 100-year anniversary of the 1918 flu,
mm-hmm.
only 2 years ago. And so the CDC did a lot of profiles on it. We did it locally. We tried to really just drive the message home that epidemics and pandemics happen and they're devastating. Only 2 years later, we're here. So hopefully this will garner more attention in terms of preparedness. Preparedness is something we can do. It really is, but we need investment, we need resources, and we need dedication.
Yeah. I mean, that kind of is going to come down towards a value system, what we value as a culture of people. And, not necessarily we valued, the health and well-being of the people around us, but, we're only as good as the lowest, you know, lowest sum or of the people we are around. And, just because you're in a fine neighborhood or fine area doesn't mean, you're insusceptible to a disease or a virus. And, it's sad to say, it's like can be a wake up call because I mean we're still not through this, and I'd like you to like kind of fill people in from what you've been working on, who you've been talking with, what you've seen, where we are in people will talk about the curve or the wave, but kind of fill us in of where we're at with COVID-19.
We're not even close to being out of the woods yet, to be honest. So projections put the peak in Washington state to be mid-April, and that's just the peak of the highest number of deaths we're going to have in a day is April 15th, according to the models that we have with a million variables being right. That's a lot of assumptions going in there. And I expect them to be more or less accurate, but at the same time, again, there's quite a few dynamics that are ever shifting and ever changing.
What do those numbers look like?
So for Washington, we could expect maybe something around like 500 deaths. It's not nearly what New York is predicted to have. But at the same time, it's not going to be pleasant at all. We haven't had 500 deaths from an infectious disease in this state in a very, very long time. So the resources in Washington state, according to these projections, it looks like we're okay on hospital beds, we're okay on ICUs, we're okay on ventilators. Again, that is a big if. The margin of error on these estimates is huge. They're like, oh, it could be as high as this, it could be low as this, but this is the middle point that we're going to give you as the estimate. So
those highs and lows are very, very alarming. Especially I look at them, as a percentage of the U.S. population. That 1 to 2% just off that. I mean,
yeah.
that's a very, very blown worst case. 3 to 6 million people, but it's not that far, not that unconceivable.
Right, and that would be everyone getting infected,
Yeah.
which right now we're having a very small percentage of the population still getting infected. Of course, if this continues unabated, yes, that will be our inevitability. So a lot of our states, Washington state included, have kicked into various different levels of non-pharmaceutical interventions. So that's kind of one of the pieces to tease apart is that public health. You have the research branch and the medical branch. It's more healthcare, dealing with treatment, dealing with vaccines. Then you have the non-pharmaceutical side of public health. And that's more what we do, which is the actual disease investigation, figuring out who your close contacts are that might be infected, asking them to stay home too, or forcing them to stay home. We can do that too. And then working from there. The nuclear option is what happened in Hubei province in China, which is like no one gets to move, no one gets to leave. That's
What was
called.
some of that stuff they would be spraying in the air? Like if they were like just spraying the streets down, I would see like just
I mean, like probably a bleach solution.
aerosol bleach and
Yeah.
bleach
No, like a 1 to 10 bleach solution kills most things, and so
aerosol bleach, but like they would just aerosol it kind of and just
probably because no one was out and about, and they were wearing their own personal protective gear so that they could do it, and they
that's
just.
just crazy just to think bleach being sprayed in the air like that. I've never heard or seen that, so it's like trying to wrap my head around it, in the spur of the moment.
I mean, they might have used as their disinfecting products, but personal preference is 1 to 10 really well. Um, and so those ways of keeping people apart to prevent disease transmission opportunities slows down the possibility of getting more people sick, but it takes time for us to see the effect of that. And so that is where those projections of the peak of April 15th in Washington come from. Because we put in social distancing only like a week ago, or with a real order with real teeth. And then it takes 2-3 weeks for us to see the worst of it and then for it to taper off again. And then we have to figure out how to kind of like let people out of this lockdown back into society and not have it resurge again. So ideally, the only way really in my mind to pull that off is we have the testing we should have had at the beginning. Widespread, readily available for everyone testing to figure out who's infected, who's not, and then let the non-infected individuals out and work.
And those tests, I've heard of a few. I haven't got tested myself. It's one where you like kind of goes in your nose and goes all the way to the back
It
of
feels
your
like pooping
your
out your
throat.
brain. You don't want to do it.
Mhm.
They're also, though, now accepting better or more comfortable testing methods. So actually what's really brilliant is now that they're trying to pursue the patient themselves swabs their own nose and not back in their brain in the front of their nose. Um, and that way we don't have healthcare providers having to spend all of their personal protective equipment, their masks, their face shields, goggles, because a patient is not infectious to themselves. They can take their own specimen just fine and then put it in a tube, put it in a bag, hand it off. So that would be a game changer because I'm sure you've seen that our personal protective equipment supplies are in dire straits and it's only going to get worse.
Yeah, I have a friend who just moved to New York City to be an anesthesiologist at a uh, hospital up on like 68th and Second, and now he's been moved right over into ICU, and every day it's just trying to keep tabs on them and keep in touch with them, and he's working on the front lines, and seeing what he has to see. It's kind of the job description you get as a nurse or doctor when you first start, but we've been so privileged to live in a society that's so safe from warfare or disease like this, that this is life, though. This is mother nature, and this is how we have to counteract and like or live with it. This is what can happen.
I think it's also, frankly, entirely appropriate to think of this as war, to be honest.
Absolutely.
And I think that we need to be realistic, but determined. We need to continue to fight this no matter what comes, no matter what happens. It's going to hurt. It's going to be pretty awful, but we will get through it in the end. We will win in the end. It's just going to it's going to take time, it's going to take sacrifice, and it's going to take sacrifice from all of us. And so being realistic about that, and especially not holding anyone to any dates of when this would be over, because that is completely unpredictable.
So hard. I don't know how they're trying to you're only going to hurt yourself, shoot yourself in the foot trying to give people dates and times.
Right. So our president said he was going to open it up by Easter. He's already taken that off the table. And it's just not a good idea to promise anyone anything in terms of dates at this point.
Mhm. Now we're talking about ways to counteract this, and quarantining and keeping people away from contacting other people is the best way to slow down the spread of this disease. But what's the difference between isolation and quarantine?
Great question. I love that because everyone is using the wrong words, and it's not really that big of a deal, but I think it's helpful. So quarantine is for people who have no symptoms. They've been exposed, but they have no symptoms yet. So trivia fact, quarantine actually comes from the Italian word for 40, quaranti, and it was from Black Plague. They would make sailors stay on their ships in the port for 40 days until no one had symptoms for 40 days. They were allowed to be on shore because it proved that they didn't have the plague. So that's what quarantine is, making sure you don't get sick so that you can't spread it to others if you did. Isolation is when you do have symptoms, when you are sick. And so now you need to stay home. Operationally, it's the same for people. You need to stay home away from others. And so that, I think, is part of the confusion, but it's different timelines between those two things. Quarantine, we have to have you stay home for 2 whole weeks because that's how we know how long it could take for you to get sick. And then for isolation, it's all about how your body heals. So if your body feels faster, woohoo, you get out of isolation faster. But if you're sick as a dog for 3 weeks, you need to stay home for all of those weeks.
I actually think I found it very effective. One positive thing of social media through this is people being able to, who have either logged their symptoms and the time that, either they've had COVID or they've had a flu, and, expressing what symptoms they're feeling, that, people can really take a look at what's happening. Because like you mentioned, if you are in quarantine mode, but you end up contracting the virus, how, where do you do? How do you stay in your home? What are ways that people can, still, not be booted from their home, where someone's like, whoa, like, hey, listen, we love you, but you got to go.
Yeah, we're trying to get out of that fear response, but honestly, like what South Korea has done and what China did is they took people who were sick out of their homes and took them to a place where they could recover away from their families to prevent their families from getting sick. And I don't think that that's entirely unreasonable. I think that that's something that we might actually have to seriously explore in this country, is having a place where people can recover safely, have medical personnel checking in on them just to making sure they're doing well, making sure, of course, they have all of their basic needs taken care of. But having people just ride it out at home with their family is just a great way to guarantee that the whole family is going to go down. And
Mm-hmm.
that is also a problem and just continues to spread the disease.
Yeah, I think, like, I mean, that's the idea of, the National Guard building field hospitals, like, using the public universities that are completely empty right now to these massive campuses they have to have, facilities such as these. I mean, I think I lived in Kuwait, and I know people in the Ministry of Health there, and they would send me videos of, they'd have these massive, massive, massive facilities, um, looking warehouses, and just people standing 6 to 9 feet apart, like in rows and in columns, just all being tested and apart from each other. It's just like,
It's pretty
it can be done. And, it's just like America. I mean, just in any, look back for World War II, it's just like we lack the discipline to get into it. But once we get the machine moving, it moves incredibly. It's just,
Absolutely. And
yeah.
again, it's one of those things where you need to have strong goals and leadership for what exactly needs to happen, getting the whole American public to sign on to that, and getting it done. Yes. I think it's doable. I think that we need to start making that action soon, 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 soon.
Yeah, and it comes down to education. I would really like to ask you, to explain, or at least express, what social distancing means to you, because I mean, I'm on the phone once a day with my family members.
Right.
Florida, I'm petrified at what could potentially happen there. I've been following this closely, and it's just, please don't go out. Why are you having game night? Like, you're elderly, you live in a 100,000 person community with older people, and it's like every day a panic of like, did you stay at home?
Right.
Did you keep to yourself? And people still traveling cross country, on flights. So please, give your spiel on social distancing.
God, all I gotta say is this is not a drill, folks. I'm telling you, this is not a drill. And by social distancing, really the better word would say physical distancing, because we want you to still have social relationships with your families and friends. Use technology to do that. You just can't be close to each other physically, like straight up. You need to keep your distance. And it's just, that's how the disease is transmitted. It's super infectious. It's 3 times more infectious than flu. If you've seen flu travel through your household, you know that that still wasn't fun. This is even more infectious. And again, we're thinking it's mostly close contact, picking up things after other infectious people have handled it. But on top of that, most viral bugs, this one included, you're infectious before you even know you're sick. So you can't just say, oh, I'm feeling fine, it won't be bad. You're actually infectious for at least 2 days before you even know it. And so that is a huge game changer in terms of control. And so that is why social distancing is so important, because you just don't actually know that you're in the clear when you're having these interactions, and you could just pass it off.
Hmm. Yeah, I think you had mentioned we had talked before this. You have found the COVID-19 in feces and in urine. So I mean, even the washing your hands after the bathroom and knowing how many people don't wash their hands after they go to the bathroom, and this is in one. I don't know if we have actual facts that this is spread this way, but it potentially can from simply not washing your hands and exchanging with it staying on the surface of your hands. Like you said,
Oh,
touching.
it's definitely spread that way for sure. And also when people blow their nose or cough in their hands or cough in their elbow and then cross their arms right on the spot that they just coughed into their elbow. Yes, that all leads to possible transmission between you, your family, your close ones. So really, I mean, good hand hygiene is everything. Like sometimes I'm like, I can't believe how revolutionary hand washing is, but screw it. I'm happy people are doing it now. Wash your hands, wash your hands, wash your hands. Hand sanitizer is second rate to washing your hands. Um, and don't go out when you're sick. Stay home as much as possible. It's just one of those things where it's like people still, I think, don't want it to be real. And that's why they're holding on and kind of being a little more defiant. I think there's a lot of fear that we're all experiencing right now, and we all react to fear differently. But ignoring expert advice is a pretty poor tact to dealing with fear. So please listen to the people around you trying to give you good information and actually take them seriously.
Well, I mean, that's one of those stages of denial, or stages of
Yeah,
I don't know,
it's like a grief stage
the grief
almost.
stage. Yeah, like if we deny it, we don't actually reflect on it being there. Like, is it actually real? I've confronted a few people about that, and I think it goes into what I want to talk about next is like information and misinformation. Um, and I know one of the big things is, like I said, once we're trying to point out blame and, point the problem, a lot of people are saying, well, we want to call this the Chinese virus. We want to call this the CCP virus. And what is the problem with calling it that? What is the problem with, people going online and getting into these very, you know, pooling, which social media and these things have done a terrible job. They claim to create community, but they just create little cesspools
Right.
of small groups who can just hear the echo chamber of exactly what they want to hear.
Right.
Uh, I mean, as especially being in public health and getting people, to take on these new not traits, but new tactics to say to defeat these diseases or battle these viruses. You know, how do you combat the misinformation and getting the right information out there?
Well, in public health, that's just what we do every day. We are always having conversations with people that sometimes are hard. We're dealing with people's different value systems. Um, and really key to ever getting anyone to change their mind is listening to them. If you just come in guns blazing and you just try and shove a point down someone's throat, no one ever changed their mind that way. So you have to have an honest conversation, an open conversation with people to figure out where they're at and why they're there. Because really, at the end of the day, there's a lot of decisions that we all have the same value behind, like a fear value. We're all scared. So if we all recognize that as a motivator, then we can get actually quite far in this conversation. But really, what we do, like, I'm answering calls from the public all day long. I'm answering calls from doctors as well. And I just make sure that I spend my time listening first to what they're asking and then responding in the pieces that I can to their specific questions, and then asking, can I answer any more questions for you? And just really being a two-way street, open conversation. On a more mass scale, making things digestible, making it really like contextual for people is very important. So for example, we have a significant Hispanic population. And so actually talking about the barbecues with your family and your extended family, we would call extended family in my context. I have a tiny family, but the cousins of the cousins,
Hmm.
That's not extended family in Hispanic culture. That is close family. And so they're always over. And when you say like only stay with your close family, well, that's their close family. So you need to talk about that in a much more culturally relevant way for with people. We've got great people on our team who represent all the cultures that we need to access, and they're able to put that context into play for people. But then also finding the best way to get that message to them. Is it the radio? It's probably not Facebook sometimes. It's not PSAs. Maybe it's TV. You got to find the right way to get that message out. We've seen some crazy stuff in terms of misinformation. Like we saw at one point that you should drink bleach to prevent coronavirus, and that is a great way to skip the sickness of coronavirus and just go straight to dying, but wouldn't recommend
Do
that.
you know who put this report out?
Oh yeah, no.
Or again, it's just someone who just made a blog post, from a dot com, and it just
Yep.
got put on. Gotcha.
Probably wasn't even a blog post. Probably was just a Facebook rumor that just took off, and people maybe shared it facetiously, but some people were like, should we actually do this? And of course, Corona beer is taking a huge hit, and everyone's loving to joke that it's Corona beer, but it there's such a thing as having a good sense of humor about things. I like memes as much as the next person,
Mhm.
but um, there is a line where it becomes racist, when it becomes stigmatizing, when it becomes problematic, that it actually causes more harm than it does help anyone laugh something off. And so, if you're thinking of this as a war effort, you need to think of how you are going to help your fellow American get through this. And that is not through divisiveness. That is through collaboration and working together at a distance.
Yeah, I mean, if you want to say like we're all soldiers right now, I mean, you nurses and doctors working on front line are much more would stay on the front lines, but
Mhm.
think of it as you're in a war. Do your part. Pretend you're a soldier. What's your order right now? Stay in quarantine. Stay away.
Or here, if you like really are getting antsy, support the people on the front line with really clear orders. Like make meals for them and drop them off at their doors. These people are probably so exhausted they're not getting good nutrients in their day. So that is a way you could support them. You could write letters of encouragement to your friends and family that are on the front lines, telling them you support them and you're thinking of them. That means a lot. That means a lot to keep their morale high and keep them fighting. So there's things you can do still without direct, your role today is you're going to do this for the
Mhm.
government or by the government's orders. There's still so much we can do for each other in this time.
In regards to misinformation, I was just thinking about it. You really are battling. I mean, you have these 24-hour news cycles, or any media company now that needs to be putting out 2, 3, 4 things in each wave of the day, the morning, the midday, the afternoon. They need to give people something to digest. And like many of the tragic deaths we've had, just like to start this year, like the Kobe Bryant one, this virus itself, it's one of those things that's beyond our control. And because we have the psychology of human beings today is like, oh, we have an explanation for everything. There's a rational reason for everything. We can put something to it. We're so free to do it that we make conspiracy theories, and we
Yeah,
love to run away with them. And we have to realize, like, sometimes there's something we can't explain to
right.
why it happened, or it's just something that just happened, and that's why it happened. It's sad and tragic, but like we have to be able to, somehow find a way to rationally relate it. And, we're getting to that point where people can't talk to each other. Like you're trying to come at it as patient, empathetical, but, you know, like you said, everybody's in their own stage.
Everyone's in their own stage, but also like I've personally had now my experience with the media as well, where we got an LA Times article. I don't know if you saw it. Skagit County made it into the LA Times 2 days ago. And it it was not quite the article I was hoping for, to be completely honest, because what we had here in our county was a choir group that got together on March 10th, when we had just announced our first confirmed case in the whole county. We now have 150 cases. It's only been 20 days. We went from 1 to 150 that quickly for a small county. So it's been a long 3 weeks since then. But on the 10th, this 60-person choir group got together and they implemented social distancing at their choir group, but they sang together for 2 hours. No one had symptoms. Yet the next day and the next 4 days after that, 45 of them got sick. So that's 75% of them went down. And actually, 2 of them have now died. And it's been really sad and really awful. And so we published just an announcement that we had a cluster in the community. It was a closed group. Our team called every single member of the chorale that was there or not, figured out who had symptoms. It was like 200 calls over 2 days that we did, and then called all their close contacts, especially found anyone who was symptomatic, and then asked them to isolate and quarantine too. But we then released it to the community that we had the cluster. No one asked too many questions about it, but then finally a reporter said, okay, who is the cluster? And we said, it's the Skagit Valley Chorale. They said that we could tell you their name. And this reporter did a good investigative job and asked the chorale to do these quotes about what happened. But where I got really dismayed with the article is that the reporter asked us a couple questions, but then didn't bother to ask us, hey, do you think this could have been an airborne transmission event? Because we would have said no. This bug is known to be transmitted by droplets, which travel about 6 feet. If you're in a room full of people trying to sing at the top of their lungs for 2 hours,
A lot of droplets get out.
you think that a lot of droplets could happen? I think a lot of droplets could happen. So the science was still there. I mean, I can't rule out airborne, but he has now really perpetuated this airborne transmission that is not really backed up at all by our situation. And so after his article, all the media agencies descended upon us and said, do you think this could be airborne? Do you think this could be airborne? And we had to toe that line like really directly with the media being like, this is not evidence of airborne transmission. And so they really wanted us to say that it was. We don't have evidence of that though. And so it's just a little heartbreaking to use a tragedy to push something that's not actually backed up by science. So, the news cycle is hard. It's really hard.
Well, I mean, like I said, it goes back to the values of us as a culture. We understand that preying on the uncertainty, the unknown, and the fear is going to sell more headlines like that, are going to bring more people in.
He slapped a really horrible headline on it too. It said that I think the headline is, they decided to have their practice anyway, and now 2 people are dead. At that time, it's brutal. It's brutal. And at that time, there was no order at all in the county or across the state that people had to not have these events. Like we said in a press conference only hours before they had their practice, that we thought that our health officer said, we recommend you don't have events of 50 people or more. Well, 60 people showed up. Are we really going to bash them about that? No. It's just a really unfortunate circumstance, and it just really sucks that he put that headline on it.
Yikes. Yeah. It's so unfortunate because, like you said, there's those who will look at all this that's happening and say, oh my God, I want it to be the worst case scenario. And then you have people, again, in their own little echo chambers hearing that, oh, this isn't real. Right. This might just, I think, people not realizing influence and, with social media or even the media itself, like you put something out there like that, that's what we would call screaming fire in a crowded theater. Mm-hmm. If you're going to do that, you need to be held responsible for that. And we've anybody can have social media if you can afford a cell phone and if you have a computer and you can able to have these things because they're free, and you can go on there and say what you want. And I mean, it's,
And it can go viral, and it becomes the next rumor that people are saying that ibuprofen, you shouldn't take ibuprofen with coronavirus. That's not backed up.
I saw that one come out at the beginning.
Yeah, it's just,
Um, can you give us some other ones that have been debunked, other things, in case people do contract this, or they know somebody with it and they don't jump the gun on something they may have seen or read? That's, like you said, I've seen these things too. So obviously they're in the void.
yeah, I mean, God, they morph day to day, so it's hard to even stay relevant with the myths that I've seen. But really, just good information is you can manage these symptoms, a lot of these symptoms, yourself at home. Your normal flu medication that you take when you feel sick will still help in this case. And of course, if you need to go to the doctor, you need to go to the doctor. You get to make that call. But it's not, it's a mild symptom or it's a mild illness. And quite a few people, like 80% of people, are going to be able to ride it out at home with their normal stuff. Don't try any new crazy medications now. I've seen people trying to really seize the opportunity of hydroxychloroquine, which is a medication for quite a few diseases. And now they're trying to self medicate their coronavirus infection, and it's killed some people already. You shouldn't be taking prescription drugs or any drugs, really. You shouldn't be taking over the counter medications, not
No.
as prescribed, period. End of story. There you go. Don't do that. That is a great way to also accelerate past the coronavirus infection and just die.
Yeah.
Just don't do it.
Why is it that some, media outlets are saying then, for different states, or, different governors who have tried to, withhold people making a run on hydrochloroquine, um, and I forgot the other drug that's been paired with it. Why are people getting upset that, you know, governors or, leaders in states are saying, hey, we can't just let you self-prescribe to that? Because, I think people don't realize it's one of the main preventative drugs for malaria. I've taken it when I've gone to South America, and it's an intense over the counter pill. I mean, it's I wouldn't say on the level of like a antibiotic, but it's going to shift, your immune system around in order to prevent and fight something that's a disease that can kill you.
Yeah, I we probably are going to have to. Yeah, we haven't done it yet, maybe in a really strong way, but we're probably going to have to start doing like massive PSAs shortly because people are going to start self-medicating and medicating incorrectly and taking the medication away from the people who are actually needing to take it for autoimmune diseases. It's
Hmm.
a lot like the toilet paper hoarding phenomenon too. It's a panic reaction. It's and it's just this crazy social phenomena that they see someone doing something somewhere else, and then they jump on it for some
That's
reason.
the mob mentality. I
It's
mean, we're seeing it happen, like you said, with toilet paper. That's the thing. We'll be able to laugh at the end of this. Like, did you run to the store and get toilet paper like an idiot?
yeah, were you
You
there
thought I
when
was gonna
there was
run out?
nothing there? All the empty hallways for in the grocery aisles with nothing in it. Yeah, just quite something. It's really also just important to not do the stockpiling thing in
Hmm.
general for everything right now, because you're also removing items from other people who can't afford to stockpile anyway in the first place. They just needed one, and you took all of them. And so it's not a victimless crime to just start saying, oh, I'm going to just buy everything out and stockpile it. You are actually potentially causing real harm to the people around you by doing that. So
Hmm.
take what you need. 2 weeks is fine. And then you don't need your toilet paper fortress to last you through to September.
I know we talked about, trying to figure out what people can do, who are quarantined in their homes, or they're even, hopefully, God forbid, they're not under isolation, and they want to do something. I think I've wrestled with that. I've heard, donating blood, but I don't know where or how you could go donate blood, or if it actually is needed. Again, I gotta go check my information.
It totally is.
How
Donating
could you go do
blood,
that safely right now in these times?
I, you know, donating blood and like the actual blood donation process, they use like sterile processes that are way more advanced than your normal doctor's office. Frankly, they are already dealing with infectious diseases and threats of infectious diseases all the time.
Mm-hmm.
So their efforts are actually quite good. And what they're probably doing in all of the blood banks right now is they keep you separated by 6 feet anyway. You need all the equipment around you. You need to be able to lie down. All of the people who are probably taking the donations are wearing masks. And so you can do that safely. And
Okay.
actually, my boyfriend tried to donate blood, and because I was bugging him to do that, and he actually couldn't even get an appointment for the next month. They're totally booked up
That's
because
great.
of the call to action that's happened recently. So feel free to call your local blood donation center to see if they actually are in need of blood and have that like availability for appointments. They might not, because honestly we've been really pushing that message for like a week now, and people have really come to the aid of the blood banks. Other places that honestly you should reach out to your Department of Emergency Management, your local Department of Emergency Management. They're the ones who put together the volunteers and they put people to work. We're still trying to figure out how a volunteer corps can assist us right now. A lot of the stuff we do ourselves in-house, and we're able to do it ourselves in-house still. That very well might change pretty quickly. And so then we would bring in volunteers. But volunteer corps could do such things as delivering groceries to people who are under quarantine or home isolation that aren't supposed to be going out. They also could be delivering them to people with immunocompromised situations or high risk people who also shouldn't really be going out. Um, I've seen plenty of apps pop up, creative tech solutions for this kind of like crowdsourcing for grocery deliveries. Um, Little insular communities like your Buy Nothing groups on Facebook. Those are great opportunities where you can offer your support to your neighbors directly. Um, and then in time, we very well might see places where we need volunteers, especially among people who've recovered from coronavirus, to potentially like transport people currently infected to a place where they can safely quarantine and safely isolate away from other people. That would be potentially a place where we need to go to, is
Mm-hmm.
use people's natural, however long it might last, immunity, because we don't know it'll last forever. I haven't seen any studies on reinfections, but we just aren't not certain about that not being possible. And so, but in the short term, you should have an immune response that should protect you from a secondary infection. So that could be really useful if we end up needing people who can take care of people who are currently sick. So more to come, but certainly start signing up with your local emergency management agencies, getting your name on the books, giving them what your skills are, and seeing if they can't use you already, if they won't be able to use you in a couple weeks.
And I think it also is a good opportunity for people who, potentially, and unfortunately, been laid off, lost their jobs, or maybe jobs are in furloughed, I think is the term. You know, there's most of the government funding is going towards, distress needs right now. So, I mean, potentially, future job, and, you're helping people. I mean, there's no better, greater feeling to help people. And this is a great opportunity for you to get into a brand new field. And obviously this is not just going to be a 1 year thing. This is going to be with us for a while until we can really, really get a hold of it. Cause there's some parts of the world that hasn't even touched yet, and it's going to get wild.
Yes, we need a vaccine. So for everyone, vaccines are great things. That's my little public health moment for the group, is that vaccines are the second best invention of public health. Sanitation is the first, saved the most lives of anything that we've ever done, is creating the toilet and creating sinks. So use those and get your vaccines.
Yeah, I mean, that's where I was gonna head to next. And lastly, I think you mentioned on our phone call before this, like this is I forgot the exact term or phrase, but you said this is a disease that's going to need a vaccine in order to, wouldn't say defeat it or at least suppress it within
Yeah.
the species. So maybe you can explain, you gave your spiel and pitch on vaccines, and I want to let you know first before you judge me, I'm with you on those. Um, because it's getting to that point, and I've seen people online like they're trying to vaccinate all of us now. They're trying to get us, like, this has been the entire thing to get people to vaccine. It's like,
Oh, the massive conspiracy theory that I'll kill a bunch of people first to make sure that you get a vaccine. Yeah, sure. Okay.
this is their thing. So I would say go into the science first, why we need a vaccine for this particular virus, and what that's going to do for us and why it's important to get this one.
Yeah, so I mean, a lot of people have asked me that actually recently, saying, "Oh, with all of these people getting infected right now, won't we have herd immunity?" And herd immunity, I like to actually say community immunity, where you have enough people in the community that are now immune that you don't have the ability to spread easily.
That's just one of the cases in the UK that they were trying to do. We're just going to go with herd immunity. We're going to let people get it. Everybody get in the tube. No worries.
Oh my gosh, that would be disastrous, of course, for a
Well,
lot
they
of
just reached
reasons.
500 deaths today. It's
Right.
unbelievably
So
tragic.
that is a great way to get to 32 million deaths in this country, is just saying, hey, everyone out there, go get naturally infected. Also,
I don't want to laugh, but it's like,
yeah, it's quite something. Um, Also, if we just let it go and never developed a vaccine, it would take like 10 to 20 to 30 years for enough people in the country to have it naturally to then have community immunity. So it's not something you can just let it take its course for the next 10 to 20 to 30 years. People will die all along the way. And that's a long time to like wait for this to happen. So those reasons beget why we need a vaccine, because then we can mass deploy a vaccine across a nation and make sure people can get immunity without having to suffer. I don't understand why people want to be naturally immune through an infection. It's a really uncomfortable, painful, if not deadly infection. So if you could get just a poke in the arm to then be immune, that seems like a better deal to me. And so vaccine development is not quick. At its fastest could be 18 months. It's certainly not under a year. Under a year, that vaccine's not a viable option, frankly. And Dr. Anthony Fauci has said so much on the press briefings. So maybe in fall 2021, we will have a viable vaccine that we can then deploy at that point. But it's going to take a long time. And so we need to stall. And that's where the social distancing comes in. It is buying us time.
I it's buying time for the vaccine, but it's also buying time because we just can't let 30 million people right away get this disease because we don't have the supplies to do that. It's just a tactic to deal with. We know people are going to get sick, but we don't have the hospital supplies. Our big case for privatized health insurance, like, oh, well, our hospitals have turned into Venezuela now. There's
Yeah.
lines out the door. I mean, I thought this would never happen, and that's a debate and a topic for a whole nother day. But,
Yes.
you know, your worst fear has finally come true.
But it's just with infectious diseases, do not care about the money you make, the insurance you have, anything else.
Mhm.
They don't they don't respect any boundaries. They infect who they infect, and as long as someone out there has the disease, they can spread it to someone else. And so really it is one of those things where it's like we're only as healthy as the person who can't get to the doctor, can't pay for the doctor, and thus will stay at home or go around and continue to work because they can't pay their bills. So they're going to keep going to work while they're infectious and infect other people. That we are as a society are only as healthy as that person.
Mhm. I wanted to say I'm so happy I got to steal you for way more than 30 minutes, and thank you for being such a big trooper. Uh, I want to leave with one thing because I think it's going to be a great scope and what's the thing? A good barrage of color. What's those things called? Well, I'm butchering it anyways, but I wanted you to kind of give like that worst and best case scenario of, from time, numbers, where we're going, and what that looks like, and what we do this, and when we do that, what happens in that result?
Well, I guess worst case scenario is 32 million people in the United States die. That's the worst. Um,
Is that over a span of how long?
oh, it could be fast and furious and terrible if we don't deal with it.
Still,
Uh, sure. Yeah. I mean, if people continue to go out and don't acknowledge social distancing, then yeah, it could be really awful really fast.
wow.
Um, and so again, it's not a drill anymore. And if we are able to really like smooth it out, flatten the curve, which is the rallying cry we're all paying attention to now, it can be way less painful than that. And that is really a factor of time, because the reason we need ventilators is because what happens physically when people get critically ill with COVID-19 is their lungs fill with fluid. And there's no way actually for us to artificially or like go in and remove that fluid for them. Their body has to do it. And so a ventilator keeps them alive long enough for their body to do it themselves. And so if we have this critical rush of people in there, then we have no ventilators and we have no time for people to actually recover on their own. And so that is how we lose people. And so we need to protect that healthcare capacity as long as we can.
I know a few doctors have passed to from treating people with the virus. How are we with medical professionals? Kind of got into one more question there, but how are we with the number of medical professionals that we have? Do we need volunteers like eventually for those asked for that part? Because we don't have. I know it's already a very very not that sought after job again towards the values of our country, but like we don't have that many of these soldiers.
We don't. We don't. And there's a whole bunch of challenges that we're going to face with staffing. We could have all the ventilators in the world. If we don't have the staff to execute the process and take care of these patients, we're still nowhere. So there's a lot of logistics ahead of us that we're going to have to figure out, and it's going to be tough. We do have medical students that could be accelerated through their programs, and honestly, it's going to be a scary world to enter, but that's kind of what doctors signed up for. Same thing with nurses. So we'll see what happens. Of course, we need to make sure that they are protected, that they are able to do their jobs as safely as they can do their jobs. So then we have to get our manufacturing in order and to actually have the protective equipment that they need. Lots of different places that we need to work on every day.
Mm-hmm. Thank you so much. I'm really grateful for your time and giving me that extra time. I got to do a quick little spiel sign off. And guys, down below, and wherever you're listening to this on a podcast or you're watching this on YouTube, I'm going to be linking a bunch of information that Leah and I talked about, and she's going to have her send over a bunch more stuff where if you have any questions, you need to look up on stuff. I even have stuff on those $1,200 checks coming in from the IRS that I want to leave to you if you need to know how to get that, because you do need help. This is war. This is a completely different scenario. None of us have ever experienced this, but we're in it together. And the more you know, the more knowledge you have, is better understanding of how you can save yourself and the people around you, which is our entire country. We're a unit. And so, Leah, thank you so much. I really appreciate your time tonight.
Oh, it was great to talk to you.
All right. Have a good one, guys.